Welcome to this essential guide on understanding and managing cervical ectropion. As a woman or a healthcare professional, it's crucial to be informed about cervical ectropion. Today, we will explore the definition, etiology and pathophysiology, risk factors, clinical features, differential diagnosis, investigations, and management of cervical ectropion. Cervical ectropion occurs when there is eversion of the endocervix, exposing the columnar epithelium to the vaginal milieu. It is also known as a cervical erosion, although no erosion of cells actually occurs. It is a normal physiological condition, which is commonly seen on examination of the cervix in adolescence, in pregnancy, and in women taking estrogen-containing contraceptives. The cervix is the lower portion of the uterus. It is composed of two regions, the ectocervix and the endocervical canal. Endocervical canal, endocervix, the more proximal and inner part of the cervix. It is lined by a mucus-secreting simple columnar epithelium. Ectocervix, the part of cervix that projects into the vagina. It is normally lined by stratified squamous non-keratinized epithelium. A cervical ectropion is the presence of everted endocervical columnar epithelium on the ectocervix. This change is thought to be induced by high levels of estrogen and does not represent metaplasia. The columnar epithelium contains mucus-secreting glands, and thus, some individuals with cervical ectropion experience increased vaginal discharge. It may also give rise to postcoital bleeding, as the fine blood vessels present within the epithelium are easily broken during intercourse. It is thought that cervical ectropion is induced by high levels of estrogen. Therefore, factors that increase the risk of ectropion are related to those that increase levels of estrogen. Use of the combined oral contraceptive pill. Pregnancy, adolescence, menstruating age. It is uncommon in postmenopausal women. Cervical ectropion is most commonly asymptomatic. It can occasionally present with postcoital bleeding, intermenstrual bleeding, or excessive discharge, non-purulent. On speculum examination, the everted columnar epithelium has a reddish appearance, usually arranged in a ring around the external os. In cases of suspected cervical ectropion, other diagnoses to consider are cervical cancer, cervical intraepithelial neoplasia, cervicitis, inflammation of the cervix, typically caused by infection, and pregnancy. These should be excluded using relevant investigations. Cervical ectropion is a clinical diagnosis. The main role of any investigation is to exclude other potential diagnoses, pregnancy test, triple swabs, if there is any suggestion of infection, such as purulent discharge. Endocervical and high vaginal swabs should be taken. Cervical smear, to rule out cervical intraepithelial neoplasia. If a frank lesion is observed, a biopsy should be taken. Note that biopsies are not performed as routine. Cervical ectropion is regarded as a normal variant and does not require treatment unless symptomatic. First-line treatment is to stop any estrogen-containing medications, most commonly the combined oral contraceptive pill. This is effective in the majority of cases. If symptoms persist, the columnar epithelium can be ablated, typically using cryotherapy or electrocautery. This will result in significant vaginal discharge until healing is completed. Medication to acidify the vaginal pH has been suggested, such as boric acid pessaries. Thank you for joining us in this educational journey on understanding cervical ectropion. Stay informed and take proactive steps to safeguard your health.